is really wonderful to be in a room with so many powerful women. I am truly blessed to be here and very excited. I'm Dr. Tristi Muir. I am a urogynecologist and I work and am the medical director of the Pelvic Health and Continence Center at UTMB Specialty Care Center at Victory Lakes. I'm also very honored to work side by side with Dr. Catherine Hansen, who's someone that you'll see a little bit later this morning. And it should be an exciting presentation talking about sex in your 60s. But first, let's work our way through to Mamba through menopause. In looking at what the demographics of the power of this room is that people are generally in their 40s to 50s. I mean, this is going to be a topic that will be near and dear to your heart, either now or very soon. So, as we see with chickens, menopause is easy. After you stop laying eggs, they eat you. So then the talk's done. But no, we're really not like a chicken, fortunately. About a third of our life is actually spent in menopause, which is a long time. And so it's kind of like a marathon. And those miles get tougher and tougher as we go along. And so you really have to train and be ready to go for it, because people that I have the privilege of caring for tell me almost every day, you know, this getting old stuff, it sure is not for sissies. And that's the truth. So let's look and see what Samantha would do about menopause.
Thanks. Are you ready to order?
I think we'll wait for a friend.
Okay.
Thanks.
Yep.
Wow, that's a whole lot of help. How many are you working there?
44. I'm on the one-a-day Fruity Pebbles plant.
Women our age shouldn't joke about vitamins.
Women who are not our age shouldn't say women our age.
Well, one day, very soon, you will thank me. I am leading the way through the menopause maze with my vitamins, my melatonin sleep patches, my bioidentical estrogen cream, progesterone cream, a touch of testosterone.
She's the hormone whisperer.
I am. I've tricked my body into thinking it's younger.
I've tricked my body into thinking it's thinner. Spanx.
And I'm telling you, no hot flashes, no mood swings, and my sex drive, it's right back to where it was.
Really? Hadn't heard.
Where are you getting your information?
From Suzanne Summers and her team of doctors. I'll get you a copy. It's a revelation.
You're taking medical advice from the woman who invented the Thigh Master?
Damn right. Have you seen my thighs? Okay, go ahead, laugh. It's working. By the time you ladies are 50, I'll be 35.
So Samantha is really going to be proactive about making her way through that menopause maze, right? She is going to hop on all those effects of losing estrogen, and she's carrying her big pill pack to be able to combat that. So what we're going to do is really try to uncover what goes on when we do lose that estrogen. How does it affect us beyond just hot flashes, insomnia? But what about our mood? What about the mind? The heart and weight gain, that's a very common question that I see too. And vaginal health and sexual function. Certainly all those things are affected by our hormones. When we look at the mind, we see that estrogen, and this is really surprising, something I learned, is that estrogen actually helps with neuronal growth, so getting those nerves and brain power to function well. It improves the synapses or communication between those nerves in different areas of the brain. It also acts as an antioxidant. And when people go through surgical menopause, so their ovaries are taken away, what it's been found is that they really have kind of a falling off of that verbal memory. And this can happen to some women, and I know it's probably never happened to you, but they begin to think, you know, I have trouble remembering simple words like, But if you think that's bad, have you ever walked into a room and really not remembered why you walked in there? And you're standing there trying to rack your brain. Well, that can be even more pronounced in men. Where this man walks into the room, in the bathroom, and just has no idea why he's even there. But it's not only estrogen. A lot of the medical problems that we bring into the menopause can really affect how our minds function. So if you carry in your 40s and kind of proceeding into menopause land, if you carry with you some diabetes, high blood pressure, high cholesterol, and you smoke, well, all those things will increase your risk of developing dementia 20 to 30 years later. And if you do all 4 of those things, then that can double your risk of developing dementia. So it's important to be proactive in preventing some of these chronic diseases if you can. It's been found that people eating a Mediterranean-type diet are less likely to develop Alzheimer's disease. And so that's rich in those fruits and vegetables and olive oil all around. I even read an article in the New York Times this week that said that they kind of slipped some olive oil in some people's yogurt, which doesn't sound like a very tasteful combination, but it decreased their appetite. And then it was thought that even just smelling the olive oil decreased appetite. So open olive oil all around the house, and we all won't feel like eating everything in the house. Also, fruits rich in antioxidants, again, those fruits and vegetables can really help to prevent dementia and treat that. And we saw Samantha opening that pill pack and pulling everything out, but really you can get great combinations of different antioxidants in the fruits and vegetables that you eat. So it's better than buying a supplement just to eat the good seasonal fruits and vegetables. Exercise also improves the blood flow, bringing oxygen, nutrients to all areas in the brain. It also helps to release that endorphins that kind of give people the runner's high and might even make you want to run again, shockingly, right? But those hormones and those chemicals can definitely improve your mood and improve your cognitive function. Even in people with dementia, it's found that exercise can improve their cognitive function. So get out and exercise. And I know that Ashley Nixon will be here to Zumba us through to the lunch hour. So get up and move everything you got. What about mood? And certainly Samantha will want to, kind of tame herself on occasion, although I'm sure she likes to rage on occasion too. But estrogen is that hormone that first half of your cycle when you have periods that kind of keeps you calm and mellow. And it's that PMS time right before you have your period that then the hormones go wacky and you're not responsible for anything you do at that point, right? Well, that's when estrogen is at its nadir. And so you can see that estrogen is a good thing. It kind of promotes the staying power and the release of serotonin, one of our great mood hormones. The other thing that hormones have effect on is in our hearts. And there are a lot of beneficial effects of estrogen on our coronary blood flow. So it causes some dilation of that blood flow, again, bringing oxygen and nutrients to our heart and keeping it pumping. And then it also decreases atherosclerosis. It decreases tachycardia or high heart rate. So lots of really great effects on the heart. About 10 years ago or so, there was a study that came out, the Women's Health Initiative, which was a large clinical trial looking at a number of women, and they randomized them. Some women they gave estrogen and progesterone to because they had a uterus, and you have to kind of keep that lining of the uterus thin with the progesterone component. And the other group, they gave some sugar pills to. And then they looked to see what that effect was on a number of different health concerns. And one was the heart, because we know there are a lot of good effects of estrogen on the heart. But what they found is when they started these women that were about 65, not right after menopause, there was not a protective effect with this combination of hormones on the heart. And so a lot of people stopped taking their hormones. They were kind of fearful of the effect of the hearts, and actually the use of hormone therapy dropped by about 63%. It was dramatic. But what have we learned over the past 10 years since that information has come out? We've learned that really if you start the hormones right after menopause, so like in your 50s, you still gain those beneficial effects on the heart muscle itself, on the blood vessels. And so there's really a decrease in cardiac events if you start early on. The other thing that we found is that when you take a tablet by mouth, what it does is it gets processed through the liver, and it can increase inflammation that can cause problems with the heart. And so transdermal applications of hormones actually lowered your risk of heart disease if you were on those compared to someone not taking any hormones or taking oral hormones. So there are a lot of other good ways to take hormones, all coming out within the last 10 years. And another reason we kind of shifted away from estrogen and giving everybody estrogen in the menopause years was the fear for blood clots and strokes. And our risk for getting blood clots or strokes certainly increases as we get older. When we're in our 40s, the risk for people not on any hormones is about 54 per 100,000 per year. But when we're in our 80s, it's 700. You can see that's a dramatic increase. But if you're taking estrogen or estrogen combined with progesterone, and then again, an oral formulation, that increased your risk even more. But what we found was, again, with transdermal applications, so avoiding those inflammatory releasers through the liver and avoiding some of the clotting factors, what we found is that there is no increased risk of stroke or blood clots with that transdermal application. That's amazing. That's different than what we've known for a long time. So very, very exciting. Now, every one of you in the room knows that Samantha is going to be concerned about weight gain, right? Because she wants to look good in her suspenders as she goes through menopause. And actually, obesity is one of the most common nutrition-related disorders in our country and throughout the world. And if we look at Texas, the rate of obesity is about 30%. 30%. So a lot of the food that we eat is just probably really kind of piling on, right? So if we look at what happens as we get into those golden years, what happens is even, and this is not related to hormones, but just kind of natural getting older, is we gain a pound a year. A pound a year. So with decades and decades and decades, you can see that those pounds can certainly add up. And we really need to be proactive because there are a lot of health concerns that come with obesity. When you are obese, you have an increased risk of stroke, heart disease, difficulty breathing, high blood pressure, diabetes, high cholesterol. Also, people that are obese as they enter into the menopausal years will have an increased risk of having urinary incontinence and decreased sexual function, decrease in orgasm. I mean, you know Samantha's going to be worried about that. Decrease in arousal. And more hot flashes, more insomnia, all the menopausal symptoms are going to be increased. Joint problems, arthritis, and a lower life expectancy. So now we're going to look at these poor little mice. Now, these two mice have one thing in common. They have both lost their ovaries. And what is found in mice is that if you lose your ovaries, you actually have a decrease in the metabolism rate. None of us want a decrease in our metabolism rate. And an increase in appetite. That is a horrible combination. And that's what happened in the bigger, fluffier mouse there. Now, the other mouse had estrogen given back to it, and it did not have those changes. You can see it's the lean mouse. So there are a lot of positive effects on estrogen, and I have a lot of women that are fearful of starting estrogen because they're afraid they're going to gain weight. Well, it's just the opposite. It can protect you from gaining weight. So menopausal hormone therapy is not associated with the weight changes or increase in belly fat, kind of that evil fat that we really don't want to have. And hormone therapy is associated with a lower overall fat, and also it improves our ability to resist kind of insulin resistance or development of type 2 diabetes. And the transdermal application has been found to be associated with more of that lean body mass. Again, all that we're looking for. We said that with age, we're gaining weight, a pound a year. So many of us find that we're in that category where we need to really be proactive in trying to lose weight. Now, if you want to pick a diet to lose weight, a low carbohydrate diet or low fat diet, just pick one that you really can stick to, not one that's going to be a fad where your weight's going to bounce back and forth. A good lifestyle. Don't drop below 800 calories a day. That's important. And also you've got to exercise, because with weight loss you can have muscle loss. With muscle loss you lose some of those fat burning cells and your metabolism lowers. And so it's important to keep all of that going in the right direction. So this woman's been on a low-fat diet, and she says it's really working. The fat hangs lower every day. Now, Samantha is going to be very proactive in her exercise program because she wants to, again, rev up her engines in a number of ways, including the metabolism, preserve the muscle, and also preserve flexibility. I think that's important for Samantha. Balance is also something that you want to keep going. So, sex and women and menopause. There are certainly differences between men and women when it comes to sex, right? Do I have an amen? Amen. For men, it's like an off-on switch. And it's on most of the time. But for women, we've got lots of knobs that you turn and twist that all can affect and interrelate into our sexual responsiveness. I mean, did our partner take out the garbage today? That is a valid point. That is one of the knobs on that machine, right? So hormones is only a small piece of that, but certainly a knob on the machine that can turn up the intensity. And so understanding how all of that works, I think is really important for us, because if we don't feel like we're in the mood, sometimes it's only hormones we blame when we need to get those guys to take out the garbage. So how does libido work in the woman? Well, it certainly is something that changes as we grow older. So if you expect your libido to be what it was when you're 20 as what it is when you're in menopause, I think you're going to be sadly disappointed. But how it works is that testosterone, the male hormone, of course is responsible for a lot of our libido, right? It would be the male hormone. And that comes from our ovaries as well as from the adrenal gland. And it's released into the blood system. And also estrogen helps with our arousal part of our sexual function. So it increases lubrication and gets everything ready to be sexually active. And you can take a tablet again that gets ingested and passes down through the bloodstream right into the liver. And what happens is in that liver, the liver pushes out, along with the estrogen, pushes out some estrogen glue. And that's called sex hormone binding globulin. And that also binds up some of the testosterone. And you can see that as that gets into the bloodstream, then that kind of ready to act estrogen and testosterone meets the glue, and some of it just becomes inactive because of that increase in that sex hormone binding globulin. And so that can decrease our testosterone. Not something we want, right? We want that desire. We want that engine burning through the menopausal years, those golden years. So if we look at estrogen, that comes from the ovaries, released into the bloodstream, and again, that could get bound up with that hormone glue. But the patch, again, avoids that liver pass, avoids getting that glue to come into the bloodstream, and it makes both testosterone and estrogen more available. So this can certainly be helpful knowledge if you have a decrease in the libido, you would and want to get on estrogen. Go for the patch, ladies. What about that vagina? The vagina gets so sad and miserable without her estrogen. I have heard many vaginas crying to me, asking for their estrogen back. What happens with the loss of estrogen is the skin of the vagina just gets so thin and very dry, desert-like. And those nerves and blood vessels are right underneath those few cells of protection, and the vagina is just not a happy place anymore. And so typically women will come to me after this type of experience where the guy looks over at her and says, "You know, babe, that was good for me. I am sure it was good for you." But you can see that woman doesn't look like she's too convinced it was an awesome response. And so she might start avoiding sex altogether. So getting that vagina back into shape with some estrogen topical cream right into the vagina, oh my gosh, it's a miracle. And you want to keep that vagina very moist and responsive. There are a number of menopausal symptoms that a lot of us will experience during these golden time. And some of those will make us a little itchy, a little witchy, maybe bloaty, sleepy, sweaty, forgetful, and of course, my favorite, psycho. For hot flashes, truly, there are a number of things that you could take, but estrogen is the number one way to treat those hot flashes. We talked a little bit about bioidentical hormones rather than strapping on the funnel to the poor pregnant mare, right? A lot of us are looking for those bioidentical hormones and think that you really have to go to a compounding pharmacy to obtain those bioidentical hormones. But that is not the case. There are a number of FDA prescriptions that come in pills, that come in patches, that come in gels, that come in creams, that come in tablets. There are a number of things that you can use that have a consistent amount of estrogen in them that are bioidentical. Exercise can also help some of our menopausal symptoms. And that release of that endogenous endorphins, you know, that runner's high hormone, also can impact our thermal regulation. And so it can decrease the hot flashes, help us sleep better, and again, put us in a great mood. So getting your day started with a little exercise will kind of allow you to cruise on through the day. And exercise is tremendously important. You know, a lot of people don't really give it as much attention as it's needed because estrogen is part of the picture, but exercise is probably the biggest part of the picture. We need to keep our balance as we get older. Falling and breaking hips is never a good thing. We need to keep our flexibility, and again, we can improve some of the symptoms of menopause with exercise. Get that body mass down and get our muscle mass up. And that also we can do with just resistance training. We need to keep our core in good health. And one of the physical therapists that I work with said, you know what I tell people? I tell them to pull that belly button up and in. Now, as a pelvic health doctor, I have to tell you, you need to be kegling too, babe. Keep that vagina real healthy and helps you prevent that urinary incontinence. So belly button up and in and kegel. Maintain your flexibility, okay? That'll really help you mamba through menopause. So we've gone through a lot of information, and in summary, basically, menopause. So what you're saying is that what I have to look forward to is 10 years of hell followed by death. Am I missing anything? So it's certainly a challenge, but I know every one of you here is up to that challenge, and you have to make a commitment to meet menopause head on. And knowledge is certainly power. And that's why you're all here today, is to learn and to experience the power of women together. So for mind and mood, exercise certainly helps, gets those endorphins going. A Mediterranean diet help and avoid chronic diseases like hypertension, high cholesterol. Don't smoke and try to avoid diabetes. That will help keep your mind sharp and focused, and it'll stabilize the mood. Estrogen can help with all of that, particularly verbal memory, forgetting those words. You know, what was your name again? So this could certainly help and stabilize the mood as well. Cardiovascular, again, diet with good antioxidants, the fruits and vegetables can be very powerful and helpful for the heart. Exercise, and then there are many, many beneficial effects of estrogen. And the transdermal way is the way to go with that. For weight, man, we're looking at a challenge, a pound a year, and so we have to be proactive. Find a diet that you can really stick to, and again, the antioxidants are good. And remember to build muscle mass. For vaginal health and sexual function, the vagina cries for estrogen, I promise you. So think about that in getting that girl healthy. Kegel away, and all of that will improve your lubrication and sexual function. Menopausal symptoms, estrogen really can be key for those hot flashes, but there are alternatives, and certainly exercise is one of them. And after looking at all the literature that's come out over the last 10 years, what I would really say is go for the patch, baby. Go for the gel. Don't take the tablets, but that estrogen has a lot of positive effects, something that we've been afraid to give a lot of women over the last 10 years. But I'm here to tell you, it's good stuff, babe. So now I think I've armed you with a little of the education that you'll need to be able to mamba your way through menopause. And then you will have earned your marathon sticker. Thank you so much for allowing me to be here and be with such a great group of women.